Hi guys, Rena, Malik, urologist and pelvic surgeon. This week I am doing one of your favorites, reacting to Grey's Anatomy. And this episode's really exciting because there is an elderly gentleman who wants a specific surgery and his family is not so interested in supporting him on that. So make sure you check it out and find out how it turns out. Also, November starts Bladder Health Month. And if you check out my Instagram, every week I will be releasing an Instagram live with another physician specializing in a variety of different disciplines, talking about how the bladder interacts with your gastrointestinal system or your poop, how your bladder interacts with what you eat, and how you can improve your bladder symptoms with weight loss. So make sure you check it out on my Instagram page. If you guys want to see those Instagram lives on YouTube, make sure you comment below and let me know so I can upload them here as well.
What I'm really here for is a AMS 700.
All right.
Penile Implant.
Yeah.
Well, usually the first step in treating erectile dysfunction is drug therapy. I can, if you're having symptoms, right?
So yeah, absolutely. The first step in treating erectile dysfunction is not a penile pump. Particularly, you will typically start with medications like Viagra, Cialis, or Levitra. And these are brand names for medications that you can take that can help you with erectile function. Typically, when you take them, you need to take them on an empty stomach or at least a very light meal, and you need some foreplay for them to work. So people who don't have success with them, you want to make sure that you're actually using them correctly. Also, if those things don't work, you don't go straight to having a surgery for a penile implant. The next step, there are other options. There are things like vacuum pumps or intraurethral suppository or tiny little suppositories that go in the urethra. Or there are intracavernosal injections, which are small injections that you give yourself in the erectile tissue of the penis to obtain an erection. And that is probably the most effective option for erectile dysfunction short of having surgery.
No. I took those pills years ago. They never even gave me a lift off. And then my wife died and I gave up. But I'm seeing this new gal from the East Wing. She's a younger woman, and I don't want to disappoint.
Good for him.
I understand, but it is a surgical procedure, so there is a question of safety given your age.
Now, come on. Can you give an old man a working Johnson?
Okay. So age is not necessarily the only consideration for this surgery. You want to make sure before you have any surgery, particularly an elective surgery for a penile implant, that you don't have any other abnormalities that might make it difficult for you to go to sleep or difficult for you to heal from surgery. So we typically check your heart with an EKG, your lungs with a chest x-ray, and if you're diabetic, we also want to make sure that your diabetes is well controlled so that you can heal appropriately from the surgery and that you don't have other complicating factors that may make healing difficult from surgery.
What we do is we surgically place the silicone implant into the penis, and when the pump is squeezed before intercourse.
Where does the pump go?
In the scrotum.
So to pump it up, I just squeeze the jewels.
So let me show you exactly what this pump looks like. Okay, so some of you may have seen this device before on my video where I talk about a gentleman who was scheduled to get one of these after he got a new penis made after his fell off after an infection. If you missed that one, make sure you check it out. But essentially what it is there is a pump right here that goes into the scrotum, and you pump it up, and when you do, these are placed into the erectile tissue, and you pump it up, and fluid goes from this reservoir right here that sits in the lower abdomen, and you pump it up, and it causes the fluid to go in to these cylinders to make them firm. And then when you are done, you press this other small button right on top and squeeze the cylinders, and the fluid goes out of the cylinders and into this reservoir.
Dad, it's ridiculous. You're 82 years old.
So? I shouldn't have a sex life? Come on, Doc. You're just getting to the good part.
No, listen to me. This is major surgery. They have to cut your... They cut you open, Dad. You could bleed or... You want to die? Huh? Over an erection?
Wars have been fought over an erection, son.
Irving, I'm sure that thing like this isn't covered by Medicare.
All right. Well, so I've not been in a situation where a patient's family has gotten involved in this particular situation because men typically are old adults and they can make their decisions for themselves. And absolutely, if an 82-year-old man wants this device and he is able to receive one because his heart is strong and his lungs are clear and he is not going to get an infection, it is absolutely his prerogative to get one. I think that in society there is this idea that elderly people should not be having sex or should not be having intercourse, but I think that's completely unfair. So ultimately, I think if this guy can get the surgery and he wants one, there should be no reason, if he has tried all the other options and this is what he understands and wants to do after going through a full informed consent, meaning that he has had a discussion with his doctor about the risks and benefits and he understands them completely and still wants to proceed, then I think that that's totally fair and possible. As far as risks of having an inflatable penile prosthesis, there is a little bit of bleeding. However, the risk of needing a blood transfusion is extremely rare. The big risk is a risk of infection because if the device gets infected, then we have to remove the entire device. We can't just treat it with antibiotics. And if we do that, it becomes much more difficult to place another device later and you've essentially be completely unable to have an erection after the surgery is completed because in order to place the device, we have to actually make a space in the erectile tissue for the cylinders to sit. And when we remove that, that space closes down and scars up, making it difficult for you to ever have an erection again after this device is placed. So this is kind of the end of the line when you've tried everything else and you really want to continue having penetrative intercourse and you want to have an erection.
You know, the kids think this is all vanity, but I really need this surgery, Doc.
Well, she loves you. She'll understand if you can't perform.
So I see this a lot. I think a lot of patients who want to have this surgery feel very desperate and feel like this is really important for them to be able to satisfy their partner. And I think if this is something that is important to somebody and they feel really strongly about it, I would not discourage them if they were able to have the surgery. And I think that's really important. So if this is something that's really important to you and valuable to you, then there's no reason not to move forward with it.
You're going to wake up and all the big stuff, all the milestones you've been looking forward to, graduation, wedding, having kids, your grandkids, it's all behind you. It's all over. All you got is a bunch of yesterdays and very few tomorrows.
God, that's so
I
sad.
haven't wanted to make love with a woman since Sylvie died over 20 years ago. And then one night, they sat me down at the bingo table with Marion.
And you just knew.
She's my tomorrow.
Oh. Guys, that is just so sweet and so romantic. I do agree with Dr. Sloan that if this gentleman, if she loves him, she will completely understand and she will not be upset because there are other ways to be intimate. But again, if this is what he wants, I think this is what he should be able to get as long as it's safe to do so.
His BP is normal. His blood work is pristine. He appears to have the heart of a 50-year-old.
So, what does that mean?
That means he's cleared for surgery.
And you really gonna go through with this, Dad?
You bet I am, champ.
Oh, that place is causing you to make irrational decisions. You're going
What is she, his
after
mom?
a younger woman, sneaking into her room at night. It's not appropriate for a man your age.
What?
Come on. It's just an erection.
Excuse me?
All the guy wants is a Woody. God forbid you get to be his age and your kids won't let you have one. He's your father. He's taken care of you your entire lives, given you everything. And now he needs something and you want to throw that in his face? You know how many people would jump at the chance to give back to their parents, who would sacrifice everything without blinking?
Go Mark Sloan.
And there's nothing wrong with dating a younger woman. It keeps you young, and that's my professional opinion.
So again, I think that this is a little bit weird, obviously, that his children are involved in this decision and trying to tell him that it's inappropriate for a man of his age. Again, it goes back to the whole society thing of people thinking that older people shouldn't have intercourse. Of course, you should involve your family in the decision to have a major surgery like this. Particularly your partner who you're having the surgery for should be aware. But ultimately, it's his decision, and them telling him what's appropriate or not for his sex life is just not okay. Okay, so make sure you come back next week, Monday, to see my reaction to the second part of this episode where he actually goes through with the surgery. Let's see what happens, and I'll let you know what I think of it. Thanks so much for watching. Always remember to take care of yourself because you're worth it.